Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are especially designed for you. You can also connect with BCDA through our agency's multiple media platforms that include our website, Facebook, the Time of Your Life Digest, Flickr, and Map, as well as abundance of printed resources. Connections to BCDA are stronger than ever, so please take advantage of the many options we offer. Today's show offers empowering information along with the option to enjoy additional programs and classes. Kathleen Young, Programming Manager at the Baltimore County Department of Aging, shares information about BCDA's 21st Senior Center. Stay tuned to learn about another way to connect and to enjoy BCDA's exciting programming. We begin today's show with popular and important topic, especially during this time of year. Yes, you've guessed it, Medicare Part D enrollment and benefits. Let's start the show with Sherry Colby, manager of the State Health Insurance Assistance Program known as SHIP. Sherry, thank you for being on today's show.
It's always good to be here. Thank you for inviting me.
Prior to starting our conversation about Medicare Part D, can you briefly share the responsibilities of BCDA's SHIP office?
Well, this office is designed for one thing only, and that is to assist Baltimore County constituents to learn about Medicare, to answer their Medicare questions, and that's what we do Monday to Friday.
SHIP really does provide an invaluable service to Medicare beneficiaries. Let's begin by talking about Medicare eligibility and enrollment. What are the basics that viewers should be aware of?
Okay, those who are eligible for Medicare are those who are turning 65, those who have successfully applied for Social Security disability will get it the 25th month that they receive their check. Somebody's on kidney dialysis, the 4th month of dialysis, and if they're getting a kidney transplant. As far as enrollment, if you have elected to get your Social Security retirement at 62, 3, or whatever, you will automatically get a Medicare card 3 to 4 months before your 65th birthday. Those on Social Security disability automatically get a Medicare card also. However, if you're not collecting Social Security, there's nothing automatic about it. You have to remember you're turning 65 and that you need to take action. All enrollment is done through Social Security.
Gotcha. What are the different parts of Medicare? Can you provide information about each benefit and what each benefit covers?
Okay, Medicare Part A is free for those, if you or your spouse work 10 years in this country. It covers if you're literally admitted to the hospital. After that, if you were admitted for 3 midnights, you're transferred to a skilled nursing facility. If after that, you need some PTOT speech or an RN in the home, and it pays for hospice. Medicare Part B, on the other hand, I call it pays for literally everything outpatient, and it also pays for the doctors, no matter where you see them. Now, both of these, Medicare does not pay 100%, so there is cost sharing with A as well as B. Part C of Medicare are your Medicare Advantage plans, your HMOs and PPOs. Medicare Part D, is your prescription drug plan coverage, which will be going into a little more in depth later.
Okay, Sherry, there are ads on TV mentioning Medicare Advantage programs that have give back programs and allude to Medicare Advantage plans having little to no copay. Can you address these topics?
Okay, that particular ad is misleading because it does give the impression that anybody that signs up for an Advantage plan will have zero copays. The only people who have zero copays are people on medical assistance or a special program called QMB. To get those programs, your income can be no more than $1,093 gross for a single person, and for a couple, the income can be no more than $1,472 gross. Also, your assets have to be low, very low. So the majority of people watching the ad are overscaled to get the benefit. We do not have any HMOs who are willing to pay your Medicare Part B premium. However, there is a state program that will pay, and that would be if it's single, your income's under $1,469, or a couple under $1,980, again with low assets. So it's not through the Advantage plan. The way an Advantage plan works is every time you use it, you pay out of pocket, and you keep paying until you reach a limit of $7,500. Then the plan will pay the remainder of your health care costs.
All right, thank you, Sherry. We're going to take a short break, but first, consider subscribing to BCDA's newspaper, The Time of Your Life Digest, now in its 43rd year. The Digest is a newspaper filled with news, the latest government happenings, columns and articles from the county executive, county council, and other Baltimore County agencies. You'll learn about Medicare services, nutrition, recipes, health-related subjects, travel, senior center programs and events, volunteer opportunities, and so much more. Subscription rates for Baltimore County residents are $5 annually. For information about the Time of Your Life Digest, please visit the newspaper's website or call 410-887-3050. If you're a business owner, this is an opportunity to outreach to a target audience. When we return, learn more about Medicare Part D. Welcome back to The Time of Your Life. I'm your host, Ethel Rasmussen. Let's continue our conversation about Medicare Part D with Sherry Colby, manager of the State Health Insurance Assistance Program known as SHIP. Sherry, for Medicare Part D, the prescription drug benefit has a designated open enrollment period from October the 15th to December 7th. Can you talk about the importance of these dates?
Okay, Medicare open enrollment, it is very important that every Medicare beneficiary on a Part D plan gets into the habit of yearly reassessing, are they on the correct drug plan. In September, these plans do tell you what changes they are making. But unfortunately, I don't think most people read the notices. This year, like the deductible is going up from $445 to $480, which I consider personally a fairly big jump. One of the plans, their premium went up $50. So these plans are allowed to change their formularies, tier structures, pharmacy contracts, premium, and deductible every single year. Therefore, it behooves each one of us to do our Part D research on an annual basis.
What type of assistance is available to support Medicare beneficiaries with their research?
Okay, well, what my office does is that we do in-person, one-on-one help at not all the senior centers, but many of them, during this open enrollment period. And so if someone is interested in having one-on-one assistance, then they would call 410-887-2059 to make an appointment, or they can now go online to schedule their own appointment. We also, if you're incapacitated and can't get out, we are doing phone interviews. And the other option is always to call 1-800-MEDICARE, which is available 24/7 to assist, particularly during this busy time.
As you said, BCDA's SHIP office also offers assistance by phone to Medicare beneficiaries, whether the assistance is for Part D or other Medicare insurance products. Please share with our viewers how they can connect with SHIP for assistance.
Okay, well, as I mentioned, that they can call us. Now, I do warn you, it does take a couple days for us to get back, but we will get back to you. And then we do have an online system where you go to baltimorecountymd.gov/agent, and you scroll down to Part D, and you will be able to ultimately make their own appointment. This is a brand new service this year, so we're kind of test driving it.
Excellent. Sherry, if you could review with our viewers the information they need to bring to their appointment.
It is extremely important that you bring either the bottles that your medicines are in, or else a list of the names, dosage, frequency, exactly as it is on the bottle. You have to know whether you're taking a pill or a capsule, whether it's generic or brand, and so forth, because it's like with any other computer, the information in, the more accurate our results will be.
Excellent. Can you share information about extra help for those beneficiaries that may qualify?
So extra help is a wonderful benefit. It's administered through Social Security. It's an income and asset-based program. So, for instance, if you're a single person and your income is under $1,630 and your asset level is under $14,700, you're eligible for some form of extra help. It means you're going to get at least some help with the premium, deductible, and with the copay. If your income is low enough to get full extra help, you pay no premium, no deductible, and no more than $3.95 for generic, and no more than $9.85 for brand drugs. So it is a very, very helpful program. And when in doubt, call my office. We do these applications all the time. When we're in the field at senior centers, we also do them.
Sherry, in closing, any final thoughts you would like to share with our viewers?
No, you're going to do the best service to yourself if either you or one of your children, the grandson, somebody does this research. If you've gone several years without having the research done, it is highly, highly likely that you are wasting money with it. We can save sometimes people $500 or even $1,000 by changing their plan. So please do the research one way or another. Thank you.
Thank you, Sherry, for taking time out of your busy schedule to share information and support Baltimore County's Medicare beneficiaries.
And thank you for having me.
We're going to take a short break, but first I'd like to share some exciting news about BCDA's Rooted in Resilience initiative. Our free monthly programs support a different theme of building resilience. November is caring and December is celebrating. To learn more about these interesting, fun, and innovative programs like Rooted in Resilience, remember to friend and visit BCDA's Facebook page often for multiple daily postings. Attendees receive an extra added bonus when attending Rooted programs, since you could be the lucky winner of a $25 gift card from our devoted sponsors, Next Day Access Baltimore in November and the Baltimore County Office of Tourism in December. When we return, we'll learn about Baltimore County Department of Aging's 21st Senior Center.